Have you ever heard someone say, they passed peacefully in their sleep and felt a mix of sadness and gratitude? For many families, those words bring comfort, knowing their loved one slipped away gently, without fear or struggle. But not every farewell is so calm. Why do some elders drift off like a candle dimming at dusk, while others face restlessness, rapid decline, or shortness of breath? Tonight, we'll explore the quiet truths behind peaceful passing and what families can do to support a calm, dignified goodbye. Point 1. The heart's final rhythm. As we age, the heart works faithfully for decades and sometimes becomes tired. In the quiet of the night, when blood pressure is lower and the body is at rest, an aging heart may slow and stop without a dramatic struggle. This can happen with heart failure, age-related weakening of the heart muscle, or an irregular rhythm that finally settles. Margaret, 89, from Yorkshire, spent her last evening sharing tea and stories with her granddaughter. She went to bed smiling and never woke. Her doctor later explained, her heart didn't fail in a dramatic way. It finished its work with a gentle pause. For families, the signs that a heart is winding down include increased fatigue, decreased appetite, and more daytime sleep. At home, simple comforts, extra pillows to support the chest, calm bedtime routines, and a quiet room can help the body rest without strain. Point 2. Brain activity and the depth of sleep. Deep sleep is the brain's most restful state. Breathing slows, muscle activity softens, and awareness fades. If a stroke or fatal event occurs during this stage, the person may already be far from discomfort or panic. Robert, 83, in Melbourne, lived well after several minor strokes. One night, during deep sleep, his body experienced another event. He never stirred. For his family, it helped to understand that his brain was already sheltered by sleep. Families can support deep, restorative nights with simple steps, consistent bedtimes, low light, a cooler room, and limiting heavy meals or alcohol late in the evening. Soothing sounds, soft music or nature audio can set a gentle rhythm that helps the brain drift deeply. Point 3. Emotional readiness and mental calm. Peace at the end is not just biological, it's emotional. Seniors who feel complete often rest more calmly. They've said their goodbyes, expressed gratitude, and eased old tensions. Acceptance doesn't mean giving up. It means feeling safe and loved. Mary, 78, from Ohio, spent her last weeks telling stories, writing letters to her grandchildren, and saying, "I've had a full life." When she passed in her sleep, her family felt her peace as if it were a soft blanket over the room. What helps? Gentle life review, looking at photos, recalling meaningful places, saying thank you and I'm sorry, and sharing what matters most. Even a simple bedside ritual, holding hands and speaking blessings, can quiet the mind and invite rest. Point 4. Chronic conditions and nighttime restlessness. Not every ending is still. Chronic lung disease, heart disease, advanced dementia, or untreated pain can make nights harder, causing agitation, gasping, or confusion. Restlessness is often the body asking for comfort or relief. James, 81, with severe lung disease, found nights exhausting. Once his care team adjusted his medications used a bedside fan for breathlessness, and propped him slightly upright. His evenings softened. Though his illness continued, his nights became quieter. Families can learn a few comfort tools: a fan or open window for air movement, extra pillows, slow breathing together, and pausing to moisten the mouth. If pain or anxiety grows, palliative care teams can adjust medications to settle the body and ease distress. Point 5. Sleep quality, habits, and medications. A lifetime of habits shapes our final nights. Tobacco, heavy alcohol use, untreated sleep apnea, and chronic stress can all disturb sleep. On the other hand, steady routines, daytime light exposure, short daytime walks, gentle stretching, and a calming pre-sleep ritual often lead to safer, quieter nights. Claire, 86, kept simple practices: a short afternoon stroll, light, nourishing dinners, and a few minutes of breathing before bed. Over time, her sleep became a sanctuary. When her last night arrived, she drifted off and did not return. Medications also matter. Some prescriptions can cause nighttime confusion or shallow breathing, while others relieve pain and anxiety so the body can settle. Reviewing medications with a clinician, especially sedatives, opioids, and sleep aids, can reduce risks and improve comfort. Point 6. Spiritual grounding and personal beliefs. For many, peaceful passing is anchored in meaning, faith, philosophy, or a personal sense of "I'm ready." Whether religious or secular, having a framework for the end quiets fear. Sam, 90, in California, told his children, "When my time comes, it's simply the next step." His calm became their calm. He passed in his sleep, and the room felt full, not of words, but of acceptance. Rituals help: a favorite prayer, a poem, a song, a chaplain's visit, or a few minutes of shared silence. Permission giving is powerful, whispering, "We love you. We're here." Rest if you're tired. Those words can soften the body and ease the breath. Point 7. Planning, hospice, and the gentle checklist. Peace is rarely an accident. It's usually prepared. Advanced care planning, writing down wishes, choosing a healthcare proxy, discussing do not resuscitate orders, and considering hospice gives families a map. Hospice care focuses on comfort, breath, pain relief, and emotional support, often available at home with 24/7 guidance. Eileen, in London, met with her nurse to document what mattered: soft lighting, her favorite hymn, and no rushed interventions if her heart stopped. In her last week, the hospice team adjusted medication for comfort, taught the family mouth care, and showed them how to position her to ease breathing. She slept more each day, then slipped away in the night. A gentle checklist for families. Environment: low light, minimal noise, comfortable temperature. Breath: fan or open window. Prop the head and shoulders. Pause for sips or mouth care. Comfort: soft blankets, frequent repositioning, lip balm, and gentle hand massage. Words: speak love, gratitude, and reassurance. Play favorite music. Boundaries: limit unnecessary alarms or procedures that startle or distress. Support: Keep the hospice or the care team's number nearby. Ask about medication adjustments. After. When the moment comes, pause. Sit together. Call the nurse or doctor when ready. Honor the person's wishes and give yourselves time. Conclusion. So why do some seniors die peacefully in their sleep while others don't? Often it's a tapestry. The heart's final rhythm, the brain sheltered by deep sleep, the quiet of emotional completion, the careful management of pain and breath, the strength of daily routines, the comfort of meaning, and the grace of planning. I'd love to hear from you. Which part spoke to you most? The heart, the brain, the emotions, the habits, or the planning? Have you walked this path with someone you love? Share your reflections in the comments. If this video brought clarity or comfort, please like, subscribe, and share it with a friend or family member. May we all age with dignity, and when the night comes, may it be gentle.